अस्सलाम वालेकुम। मेरा नाम अनम उमैर है। मैं डाइटिशियन न्यूट्रिशनिस्ट हूँ और सेहत कहानी के प्लेटफॉर्म में हेल्थ न्यूट्रिशनिस्ट जॉब करती हूँ। आज हम सेहत कहानी के प्लेटफॉर्म से डॉक्टर रीनू के साथ हैं जो एक गायनेकोलॉजिस्ट हैं। थोड़ा सा इंट्रोडक्शन में पहले दे दूं डॉक्टर रीनू का। डॉक्टर रीनू एक एमबीबीएस डॉक्टर हैं फ्रॉम पाकिस्तान, अयूब टीचिंग हॉस्पिटल पाकिस्तान से उन्होंने किया है। शी फर्दर डिड हर एमआर CPI from Ireland and MRCOG from UK। और इसके अलावा उन्होंने जो है पाकिस्तान में टर्शरी केयर हॉस्पिटल में अपने मोर देन 10 years वहाँ काम किए हैं। नाउ शी इज बेस्ड इन कतर एंड वर्किंग देयर एज अ गायनेकोलॉजिस्ट। आज हम जिस टॉपिक में आपसे बात करेंगे वो टॉपिक है एंटीनेंटल केयर ड्यूरिंग पेंडेमिक, या उसको मैं उर्दू अगर अल्फाज में बोलूँ आप सबके लिए तो प्रेगनेंसी, पैदाइश से पहले बच्चे की किस तरीके से आपने केयर करना है, क्योंकि थर्ड वेव जो कोविड की चल रही है पाकिस्तान में और जिस तरह की केसेस राइज हो रहे हैं, बहुत सारी प्रेग्नेंट औरतें डर रही हैं बाहर जाने से कि अगर हम जाएंगे तो हमें हमें ना लग जाए, हमारे बच्चों को ना लग जाए, आने वाले बच्चे को। और वो अपनी अपॉइंटमेंट्स को मिस कर रही हैं विदाउट नोइंग कि उनके लिए वो अपॉइंटमेंट्स कितने जरूरी हैं। अपॉइंटमेंट्स को ऑन टाइम करना, अगर आप नहीं जा पा रहे हैं बिकॉज स्ट्रिक्ट लॉकडाउन बहुत सारी सिटीज में हो रहा है, कहीं पे पार्शली है, कहीं पे स्ट्रिक्ट वो कर रहे हैं बिकॉज ऑफ द केसेस जिस तरह के चल रहे हैं पाकिस्तान में, तो किस तरीके से आप सेहत कहानी के थ्रू गायनेकोलॉजिस्ट से अपनी कंसल्टेशंस ले सकते हैं, आपको डॉक्टर रीनू सब बताएंगी। तो डॉक्टर रीनू आपके पास में आ रही हूँ। अस्सलाम वालेकुम।
वालेकुम अस्सलाम डॉक्टर अना।
डॉक्टर रीनू, मेरा फर्स्ट यही क्वेश्चन है कि ये ANC क्या होता है, व्हाई इट्स सो इम्पोर्टेंट?
हाँ, वालेकुम अस्सलाम डॉक्टर अना, थैंक्स फॉर हैविंग मी। एक्चुअली एंटीनेटल केयर, ANC stands for antenatal care, and this is really important in the pregnancy क्योंकि antenatal care होता है, it is the mean of identifying high risk pregnancy and educate the woman so that she can have a smooth pregnancy and can have a healthy outcome and healthy baby as well. So it's really important during the delivery so the woman can go without complication, and if there's any risk we can identify on time.
Okay, Dr. Renu, how many visits are required and what are the importance of each visit? क्यों ये इम्पोर्टेंट होता है हर जो है वो ट्राइमेस्टर में औरत को जाना है, हर हफ्ते, कभी कभार कुछ हर हफ्ते डॉक्टर्स बुलाती हैं। Why is that so important?
Very good question, Dr. Anna. Actually, if the woman is pregnant for the first time, according to NICE guidelines, she need to have a 10 visits during the pregnancy. But anyone who has been pregnant before, she can have 7 to 9 visits. It depends on her conditions. So there is importance of each visit. Because the first visit, which is taken around 10 to 12 weeks, it is just to know the patient is taking folic acid. Ideally, the antenatal care should be started before getting pregnant because the folic acid is very important and it is given to just any defect in the baby or neural tube defect. It avoids that, so it helps in that. And we need to tell the patient about the food hygiene, how to reduce about the infection which is related with a certain food like raw food or some cheese, some type of cheese, to just prevent the listeriosis. And the other is we have to do some tests at 12 weeks scan, 12 weeks of the pregnancy. It's really important. At this weeks, we do the Down syndrome screening. We do some blood tests to see how the hemoglobin of the patient is, and there is scan is done just to avoid unplanned induction at the end of the delivery, at the end of the antenatal period. So this is really important. And then after that, there is a 20-week scan, which can be done during the pregnancy. And this 20-week scan actually is done to do the detailed scan of the baby, to see the baby heart, the baby brain, and all organ of the baby is done by the sonologist. And it's really important. So in this, we can see the localized the placenta, we see the baby condition, and after this 24 weeks, the OGTT, which is the oral glucose test, it is recommended to do. And the 28 weeks, some tests are repeated as well. So I can say later in the detail if we have a time. And the 36 weeks, we discuss with the patient about the delivery plan, how she will look after the baby, and how she will go through the breastfeeding and how she can cope with all these, and if there is anything any issue she can discuss. So woman should be just, she should be open and she need to discuss with her doctor so the care in the pregnancy can be optimized in this way.
So the doctor that the importance of 36 weeks is to also give her the best awareness कि किस तरीके से उन्हें अपनी further on delivery के बाद nourishment रखनी है, nutritional point of view क्या होना चाहिए, breast feeding किस तरह करानी चाहिए, ये भी important होता है gynecologist को explain करना. इस पे आप थोड़ा सा कुछ further कहेंगी?
Yeah, sure, Dr. Anam. Actually, this is very important. We have a nurse and we have a dietitian and we have a breastfeeding nurse who can counsel the patient how to do it, how effective it is, how can it prevent having some infection or early in the after the delivery, because the breastfeeding is the bonding between the mother and the baby, and it's also tell about how to importance and which way it should be done to avoid any cracked nipples, and also to have a to just continue this bonding, because it's really important bond between the mother and the baby.
Okay, thank you, Dr. Reeno. The next question is कि appointment को किस तरीके से वो ले सकते हैं? Pregnancy appointment, antenatal
Yeah,
appointment जिनको हम बोलते
most of the appointment, it's ideally it should be done face to face, because it's really good way the patient comes, she communicate with the doctor, she just explain her issues. But some of the appointment it can be done by the telecommunication or can be done by the remote way, like a virtual meeting or the teleconferencing. Nowadays I'm just started working in the Sehat Kahani, and I can see the platform is really good. It show how to communicate, it show all your previous visit, so you can really communicate. So some of the visit in which you need to do the scan, like 12 weeks, 20 weeks and 28 weeks, the rest of the visit can be tailored, because there is a risk of corona to the patient as well. So we can't, because this is a new condition, and still it's with 1 year we have, but still too much research needed to be done. And there is regarding vaccination is available as well, but people are getting infection after vaccination as well. And it's the vaccination according to WHO, it's safe in the pregnancy. So we can give vaccination as well. And some of the visit we can just tailor according to the teleconferencing.
हैं. Exactly, Dr. Reeno. Actually, vaccination लेने में भी बहुत सारी pregnant औरतें थोड़ा सा hesitate करती हैं, डर रही हैं. They have a fear in themselves, और वो fear obviously कोरोना की वजह से उन्होंने अपने में बहुत ज़्यादा रखा. So, Dr. Reeno, what
Sure.
will be the risk factors for diabetic patient? Gestational diabetics है, तो उनके risk factors क्या हो सकते
एक्चुअली जेस्टेशनल डायबिटीज पेशेंट को एक्चुअली हो जाती है और ये ड्यूरिंग प्रेगनेंसी हो जाती है, तो उसका रिस्क फैक्टर है अगर कोई फॉर द फर्स्ट टाइम प्रेगनेंस है. BMI, always we need to try our BMI should be less than 30 kilogram per meter square, because BMI more than high, and anyone who has a previous delivery of more than 4.5 kg baby, or who have family history of diabetes or previous history of diabetes and ethnicity, like South Asian, Black Caribbean, and Middle East, we are more prone to diabetes. So they need to be screened in the pregnancy and should be managed accordingly.
हैं? Thank you, Doctor. And why it's important to give aspirin? Aspirin क्यों हम देते हैं कुछ patients?
Yes, nowadays we can see most of the women they're taking aspirin haphazardly. According to the NICE guideline, aspirin should be started from the 12 weeks. We shouldn't start it before that. And there is certain criteria to whom should be given. I'll just say very briefly, like age more than 40 years, and those who are pregnant for the first time, and who has the pregnancy intervals for more than 10 years, and family history of preeclampsia, any history of the high blood pressure in the pregnancy, history of diabetes, or any renal disease, or woman who is carrying more than one baby, they need to be started on the aspirin according to the criteria.
And what will be the most important factors for healthy pregnancy?
For a healthy pregnancy and healthy baby, it's always important that the doctor and the patient should have a bonding between. The patient should be open to discuss anything, and the most important is support from the partner and support from the family. because it's really important. If the woman will be satisfied, she will go through all the period, this 9 months smoothly, and the risk of complication will be less. And psychological health is very important. And these women who are pregnant, they're very vulnerable and should be asked at pregnancy that in the last 4 weeks, if she feels down, depressed, and hopeless, because we want to identify any triggers on time. If any triggers are there, they should be sought on time.
थैंक यू। ओके, ये बहुत इंपॉर्टेंट क्वेश्चन है डॉक्टर, क्योंकि ये अमूमन देखा गया है। आई हैव फ्यू क्वेश्चंस लिंक विद इट। व्हाट आर सम इमरजेंसीज ड्यूरिंग प्रेगनेंसी?
The emergencies depend if it's early pregnancy or in late pregnancy. Any bleeding in the early pregnancy depend of amount of bleeding. It could be an emergency and should be treated, because sometimes even spotting, the woman can have ectopic pregnancy, the pregnancy which grows in the tube. So we need to know about it. What just to confirm that the patient is carrying intrauterine pregnancy. It's important. Otherwise, it can give you bleeding and life-threatening conditions. The other one is bleeding in the late. Bleeding is always like it's a dilemma. The bleeding in the later pregnancy can be due to certain complications, so it shouldn't be just overlooked. And if there is any one woman, we do the urine test in each visit. This is to identify if there is any protein in the urine, because sometimes the woman blood pressure is high. Due to high blood pressure, they start losing protein in the urine. So it's affecting the blood pressure is affecting her organ like kidney. So it need to be done. It is an emergency, because if it's not treated, it can lead to the preeclampsia, which the woman leaves edema, and later on they can get a fits as well. So all these are different type of emergency according to gestation age, and it need to be just worked on time on it.
Okay, Dr. Reeno, yesterday my patient was asking me, वो आई थी मेरे पास कंसल्टेशन के लिए, तो उन्होंने मुझसे कहा कि she wants to travel back to Pakistan. She was pregnant, 7 months pregnant. Even though उनको मना किया डॉक्टर ने भी, और आपकी क्या राय होगी? मैंने भी उनको मना किया कि this is not the safe time to travel. क्या आप इसमें कहेंगे कि क्या पॉसिबल इमरजेंसीज हो सकती हैं अगर एक प्रेग्नेंट औरत ट्रैवल कर रही है?
Good question, Dr. Anna. First of all, we need to do about the gestation age, how many weeks she is pregnant, because after certain gestation age, woman can travel to the other countries. After that, the due to restriction, because the air flight, they won't just allow it as well. So it's the one reason. The other reason, in this time, I think the Qatar is comparatively safe. No one is safe. Nowhere. We can't say this. But in Pakistan and India, the situation is real horrible nowadays. So the good idea will be to stay where your antenatal has been taken place, continue with it. After delivery, still you can think about it. And the rest we can't impose. So just we have to respect her wishes. Yeah.
And the last question that I would like to say कि टेलीमेडिसिन सेहत कहानी को, उसके इश्यूज को किस तरीके से रिजॉल्व किया जा सकता है? अगर किसी को प्रॉब्लम हो रही है तो वो किस तरीके से आपसे कांटेक्ट करे थ्रू द प्लेटफॉर्म ऑफ सेहत का?
Yeah, it's recently I have joined the Sehat Kahani, and to be honest, it's really a good platform where you can see your patients. You can just communicate like face to face. I really felt good, and the patients are very satisfied. They are calling me again and again. And one thing is that you can see your patient, you can advise them some blood test, and on the platform there is a good, like you can see your past visit, what your patient has done with you. So you can go through the patient history and you can educate the patient. So if the patient has anything which they can't go physically due to current situation, so Sehat Kahani will be a good platform to use it, and the patient get reassurance by easy way just sitting at home and call. And I think it's really a good idea to do that. And most of the women in Pakistan, I'm happy that they're using it and they're aware of, because in this way, once we are doing communication, and the other ways it can improve our skill as well, how to communicate. So we are learning from these things as well.
थैंक यू सो मच डॉक्टर रीनू कि आपने इतने अच्छे से कुछ क्वेश्चंस थे। ये नॉर्मली क्वेश्चंस होते हैं प्रेग्नेंट औरतों के जहन में भी, जस्ट बिकॉज ऑफ दिस कोविड इनको बहुत ज्यादा प्रॉब्लम हो रही है बाहर निकलने में, डर सी गई हैं। इवन उन्होंने अपने खाने पीने में भी खुद से रिस्ट्रिक्शन कर दी है कि हमें ये नहीं खाना क्योंकि हम अभी तक डॉक्टर के पास नहीं गए, या वो नहीं खाना। देयर आर सो मेनी थिंग्स दैट आई हैव आल्सो सीइंग इन माय कंसल्टेशन। तो मैं आपको इसका अब क्लोजिंग नोट यही कहूंगी, इट इज वेरी इंपॉर्टेंट फॉर अ प्रेग्नेंट वुमन प्लीज गो एंड कंसर्न विद देयर गायनेकोलॉजिस्ट क्लिनिकली। अगर वो फिजिकली नहीं जा सकती हैं, लॉकडाउन हो रहे हैं या उनको डर है, तो वो प्लीज टेलीमेडिसिन के थ्रू, सेहत कहानी के थ्रू अपनी गायनेकोलॉजिस्ट से कंसर्न करें और उनसे पॉसिबल कॉजेज पूछें। इफ जैसे डॉक्टर रीनो ने भी एक्सप्लेन किया कि बहुत सारे ऐसे सर्टन कॉजेज हैं, टेस्ट हैं जो घर में बैठे नहीं हो सकते हैं, यू आर सपोज टू गो टू द हॉस्पिटल और क्लिनिक अपने टेस्ट को कंडक्ट करने के लिए। रिजल्ट डॉक्टर देखेंगी, फिर आपको फर्दर बताएंगी मेडिकेशंस आपको कब तक लेनी है। सेल्फ मेडिकेशंस अपनी ना कीजिए प्लीज, these things are harmful for you and for you. So thank you so much Dr. Reenu for your time. I hope कि audience को ये अच्छा लगा होगा और they must have a clearance in their mind. Thank you.
Thank you, Dr. Anam. It was really nice to see you. And okay, thank you.
Thank you.